giving you an unbeatable bonanza from now until the end of October. Yes! From now till the end of October, you stand a chance of winning a bag of rice when you receive monies in the Gambia from UK, Europe, USA, Canada and Switzerland with Supersonic's money transfer. Amazing! So from now till the end of October, every time you receive monies in the Gambia from UK, Europe, USA, Canada and Switzerland, you stand a chance of winning a bag of rice. Only 100 bags available, so hurry now and be part of the 100 lucky winners in this special unbeatable bonanza from now until the end of October with Supersonic's money transfer. Enjoy our safe, fast, reliable and convenient money transfer service with the largest payout network in the Gambia with charges.
You want to know about the Gambia entertainment industry. You want to know the existing policies and programs of the arts and culture sector. You want to know about the governance and management of the arts associations. The program will throw a fresh light on the entertainment industry in focus. We will touch so many angles about the cultural sector, the opportunities and challenges, and interrogate them and most importantly, offer solutions.
Director of Pharmaceutical Services, Papan Niksabali, and Director of National Public Health Lab, Sherifu, who is, I think he has gone on for some official business, and all the teams from the WHO, from the Ministry of Health, and the media also, our partners, so very important partners in the fight against COVID-19. If we go back and remember 1 year back, last year, the pandemic was declared on the 30th of January as a public health emergency of international concern by the World Health Organization. And subsequently, on 11th February, the terminology COVID-19 came in to just standardize also the communication. So over time, we have been really battling with this disease to contain it. Initially, our knowledge was limited, but with little information, we are able to apply the standard public health measures, which are known to be effective to contain any infectious diseases. And we are able to contain the disease in many countries, in many parts of the world, without even the arrival of the vaccines, without any treatment. And so as a result, WHO still recommends that all suspected cases first should be tested to know whether they are infected with COVID. And once they are also known to be infected, then the subsequent measures have to be applied to contain the spread of the disease. And in this fight, the medical supplies and equipment come in the picture just in one aspect of the response, in managing, diagnosing cases and managing also the cases that are also known to be COVID-19 cases. So it's just a component of the whole response. It's not a solution by itself. This is what I want to emphasize. So today we are handing over a small portion of the items that we have been delivering to the central medical stores since April 2020. Because of the urgency, most of the items are usually required urgently. So some of them are actually even delivered directly to the central medical stores without even touching our offices. Because our aim was not really actually about the official handover, but at least about protecting and saving lives. So over the time, then we have been doing this. And this portion that we are handing over today is a small portion of 20,000 viral transport medium, which we call the samples that usually take from the person and store it and transport it to the laboratory. These are a little bit, they look very simple, but very expensive. One piece is costing almost $2. So there are about 20,000 of them that are going to be handed over. And we have also the rapid tests. Normally, up to now, we are using the PCR test, which is always done in the laboratory. But now with these tests, rapid tests, we should be able to do testing in a field setup. Anywhere, the test can be done, and it's very quick. Within 30 minutes, you will get results. So these are the items that we are handing over. The other important component is the patient monitors, and for serious cases that need management at the facility, there are some equipment that are vital. Those are the equipment that also we are handing over today. So we believe with this few equipment that we are handing over to the ministry, we can actually augment the services that the ministry is already delivering. We are not starting from the scratch. We have already something, but this will also really improve further the quality of service that we are going to deliver at facilities. The viral transport medium is worth about $32,000, and the rapid tests of 10,000 is about 50,000, excluding freight and so on. It's $5 per piece. And additionally, the patient monitors and all the other equipment is about worth like $157,000. Only these are only for today. These supplies are just a small portion. And as I already said earlier, since April 2020, we have been actually delivering some supplies to the Central Medical Store. And when we just add all the items, they are worth close to $1 million have been handed over to the Ministry of Health. And besides, it's not only, we are not only in medical, normally we are not even equipment or money organization. We are a technical organization. We have been also supporting the Ministry of Health in providing certain technical support, critical support, like in case management, critical care, management of critical care COVID patients, plus life-saving skills, and also the management of routine case management of uncomplicated COVID cases, infection prevention and control, including guidelines and so on, development, coordination of also the incident management, meaning the emergency management system support, the surveillance and risk communication, and so on. I think these are the areas we have been supporting and will be continuing to support in these areas. So I would like to stress that who is still committed to support the government of the Republic of the Gambia, particularly the Ministry of Health. And this is just one of the support that we are handing over to the Ministry of Health. But the equipment and the supplies are not the only solution. So I would like to emphasize certain issues that we should never forget and we should never really relax. For example, once a person is tested and positive, the person positive should be isolated from other members of the society, the family, and so on, because we want to stop onward transmission of the disease. That's how we contain the disease. The other thing is, once we know also there are contacts, usually, once you are diagnosed positive, then you have to also trace people that are also in contact with that case. That will help us also to further contain the spread of the disease. This should continue. Those who are positive also should receive quality care. And then this quality care has to be improved through training and provision of equipment. This is where the equipment come into play. And health facilities should also ensure that their facilities are not also breeding ground for COVID-19, because if we don't observe infection prevention and control measures, that also is a problem. it will actually further propagate the spread of the disease. So they have to apply stringent infection prevention control measures in the facilities to encourage people to come and access other services other than COVID-19 services. We also, as individuals, individual members of society, we have responsibility. If every one of us take responsibility and use the preventive measures that we know, like washing hands, keeping distance, wearing the masks all the time, we can actually further also strengthen the response in the country. So there is no little contribution. Every contribution that we do as individuals is very important. So I would like to emphasize at this opportunity for everyone to really pay attention to the COVID-19 preventive measures that have been already repeatedly been communicated by the government, the Ministry of Health, and other partners. And these are very, very important. And some also important other aspects that are the recent tool that just arrived in the Gambia. We are excited last week, if you remember, the vaccines arrived against COVID-19. And we have to take them. If we are eligible and if you are offered, please don't hesitate. Jump on it. You are amongst the very few lucky ones around the world to receive the vaccine. So please, when you are offered, take the vaccine. There is another important battle also, which is equally important as fighting the disease directly, which is fake news and misinformation. This is the biggest challenge that we are facing around the world. So this is where I think the media, colleagues, you are coming into play and help us really to deal with this. Get the right information from the right place before you even air any information that's really controversial. Confirm from the right source and spread the right information. Help the community to get the right information. Not every information, but the right information. This is what I would like to appeal to all of us. So I urge all of you to take personal responsibility and take the preventive measures seriously. With that, Honorable Minister and your team, I thank you very much for your commitment throughout the fight against the COVID-19 since January last year. And you have been at the forefront, you have been leading the team and the whole partners that are working with you. And your leadership has been so exemplary. Your commitment is unparalleled. I know how much you are committed. You don't even have time for your family. I know that. And I really commend you and your team members who are really committed and working hard in the forefront to fight this COVID-19. I thank you very much for your attention. Thank you.
Thank you very much, WR, for that brilliant statement. I think we all heard him very well. Really, we cannot thank enough WHO for all the support.
Maybe I would have been able to address them directly. But what I know is that, yes, we've all heard about some countries having taken those precautionary measures. They are called precautionary measures as suspension. But yet still, as a country, we go by international standards, not what actually has been done by one country or the other, and gets to be disseminated on the news platforms. We go by international guidelines. There are expert committees, and typically WHO is the custodian of those guidelines when it goes to the international arena. So countries listen to the WHO, and from the information we are getting, it is not recommended. WHO is not recommending a ban. Yesterday we had a meeting, and when we had that meeting, it is believed that the benefits outweigh the risk. Even if you look at what is elsewhere, when they talk about the thromboembolic phenomena, and you would have heard the analysis being that even that is not beyond what ordinarily happens in the communities without vaccination. So not that there is a spike in thromboembolic phenomena, but nonetheless, over the weekend, so these things happened yesterday, Friday, when we got to hear about this. So over the weekend, no vaccination was taking place in the Gambia, so that we meet and look at the advice, and that's what we did exactly yesterday. And as we speak today, we have an immunization technical advisory group that is meeting today to look at the vaccination issues, and you'll be informed accordingly. But the advice is now not to really stop, because that's the WHO advice, right? But before we had the meeting to even get that advice from the technical, we also over the weekend did not vaccinate to be on the safe side. But the advice is to continue vaccination.
Thank you very much, Honorable. With that, we come to the end of today's session.
Gentleman will sit with all of us in a room, whether it's a weekend, whether it's an afternoon, till 8 p.m., 9 p.m. Sometimes it is a very rare opportunity to have such a man. We thank you very much. And as we keep on saying, when the leadership is correct, the tendency for the followers to be correct is there, because they have a good example. So the followers, in this case, have decided to follow the footsteps of their leader, and that is why we have a good partnership. So we say the team spirit is there, and that is very important. And we encourage each and every one of us for us to work as a team, for us to follow the visions of the government, of the Ministry of Health, so that we can combat this. COVID-19 is not a political tool. It is not a tool for disputes. It is not a tool to settle scores. It is not a tool to be exploited by anybody, because it affects the lives of human beings, real human beings. COVID-19 doesn't know our social belongings, doesn't know which group we belong to, doesn't know our tribe, doesn't know our social status. It is a disease, and it should be seen like that. We support each other as a country to move this country forward, because it could affect any one of us. The people who get infected and who end up dying, we are not better than any of them. We are as human as they were. So that means we could all potentially be infected. So we should not be complacent in any form. We should follow the government's advice. We should support the government. WHO and other partners are doing so. They've been supporting technically. We can see technical experts of WHO standing around here. This had been on since the beginning of the pandemic. They've been bringing in experts to stand by the Ministry of Health, to look at our strategies together, to bring in international experience, to guide the processes, and together with our people, we are moving things forward. And we thank them for all the technical support they've been giving us. Equally speaking, there has been support with regards to materials since the beginning of the pandemic, with test kits, personal protective equipment, with a host of other equipment that have been donated to strengthen our capacity to be able to deal with COVID-19. By and large, we can all agree that we've come a long way. Alhamdulillah, we've been able to deal with COVID-19 the way we did so. There have been challenges. It's never been perfect. But I think the team and the partners did very well. And at this juncture, I want to also use the opportunity to thank all the health workers who have been there throughout. They're still on it. They've been there from the beginning. They've been there when things have been very, very difficult. And they are still there because things are still difficult, working together, forging ahead to save the lives of the people in this country. We want to thank all the health workers. But of course, in media, you've not been left behind. From day one, you've been there. You've been waiting under the sun, under the rain, to make sure that the information gets to the people. Because the truth of the matter is whatever we say in the meetings, in the offices, if not through you, nobody will care about them, because it has to get out to the people by your media. And without that, we wouldn't have been able to get to the point where we are today. So your contribution has been very remarkable, and I assure you that we appreciate your efforts from the bottom of our hearts. But it is a continuous process, because we need to continue to sensitize the people about the do's and don'ts. The rules of the game has not changed. The wearing of the mask is as important today as it was. The hand washing is as important today as it was. The social distancing is as important today as it was, because now we have evidence that they work. Then probably we thought they work. Using science, using common sense, we thought they work. But now we have a lot of evidence to tell us that they work. So I think it's an opportunity for us to be able to contain the disease. The vaccination has started. The vaccines have come. So vaccines are good. We are happy that these vaccines have arrived. We today remember the people who lost their lives in this country and other parts of the world, including our colleagues, some health workers. We are saddened by the fact that they didn't have the opportunity to have been vaccinated. Probably if they were vaccinated, they wouldn't have died, but there are no vaccines. So I think it's an opportunity for all of us to get vaccinated if we fulfill the criteria. And as time goes on, all the people here would have fulfilled the criteria, because the age limit would have come down to those who will get vaccinated. And I think we should send that message across to the people of this country. The vaccines are safe. That's why we are using them. You have all seen, we have gotten our first shots, and alhamdulillah, we are all doing well. And we look forward to having our second shots. And we encourage all the other people who are eligible to come out to get vaccinated, because it's a very, very important step in our efforts to deal with COVID-19. The morning is far gone, the blur, but we just want to close by thanking you very, very much on behalf of the government and the people of this country for your leadership, your commitment to the Gambia, because you go beyond the usual working hours, the usual working framework, go an extra mile, bringing your team on board to make sure COVID-19 is contained in the Gambia and it is done away with. Once again, we thank you very much. Thank you very much.
Thank you so much, Honorable Minister, for that wonderful remark, which of course all boils down to thanking WHO country office, the Gambia, and more especially the leadership of the WR. As he already said, we are all living witness studies. Even the media can attest to this, that the missions are always doing their part, and they in fact go an extra mile to do what is required of them. The clear example is always set by the Honorable Minister himself, when we have to stay in beyond working hours to make sure we deliver what is expected of us to help the Gambian population. So, and at the background, there is always WHO, especially the leadership, who are always with us, giving us all that kind of technical support to make sure we have the best as far as health is concerned in the Gambia. And of course, we have the best, because this is a living witness. We are all seeing the vaccination have started. And many countries, we are ahead of them when it comes to this particular program. So definitely we have to be very much thankful again to WR and the team. And also we have to thank the Honorable Minister for such a wonderful leadership. Thank you all. So we may now proceed to the closing remark by Director of National Pharmaceutical Services. And then from there, we will have the handing over ceremony. That will be
Okay. Okay. So can we do the closing remark, then we allow question and answer? Is that okay? Okay. So we'll come back to you. Okay. So you want to come for the cameras, or is okay? That's fine. You can come this way. Good morning, Minister of Health, Dr. Ahmad Lamin Samate, Country Representative, World Health Organization, Dr. Desta, Director of Health Services, Director of Public Health Laboratory Services, colleagues from WHO office, senior government officials here present, my staff, and the media. Once again, we are grateful to be part of this very important occasion, witnessing yet again handing over of these very vital commodities. Central Medical Store is the logistic hub of the Ministry of Health, where we have the opportunity to receive and see all items being purchased by the Ministry of Health and the donors. And I must attest to that. WHO has been one of our most consistent donors in these past 2 years. With the effect of the pandemic, we have received numerous vital and important items from WHO to strengthen our fight against COVID-19. I must thank the Office of the WHO, with Deborah himself and the technical staff, who are not only providing technical support, but material support to help us fight against COVID-19. Some time ago, I made a statement that from the beginning of the pandemic to today, we have not run out of any personal protective gear in this country. There has not been any stock out of personal protective clothing in this country. We mean to say that the government of the Gambia has done its part very well and been supplemented by very worthy partnership. Among them is WHO, and we are most grateful to this. But it's no news since there is no crisis. But when there are crises, it becomes a news. We are hearing from other countries where there are crises of shortage of personal protective gears, health workers going for demonstration. But since here we don't run out of it, it's no longer a news. But it's important to note that the contribution of the government of the Gambia and partners putting together has resulted to that we have experienced those shortages. So it's something commendable, and we must mention it when we meet colleagues and when we meet the media, so that it becomes clear that government has done tremendously to ensure that people are protected, health workers are protected by providing these important items. And more importantly, our very trustworthy partners. And WHO, as I said, is one of those that we will mention numerous times. I was going through the list, and I realized that yesterday when I was reviewing the supply pipeline for the year 2021, some of the items that we want to procure for 2021 appeared in this list. We mean to say that either we reprogram those items that we are going to buy, we reprogram the money we are going to use to purchase those items to buy other vital, important commodities. Thank you once again. For the staff of WHO, we are family. We interact with them many a times. We've been frequenting their offices. They also be frequenting our office to exchange ideas on how to manage the COVID pandemic. We say thank you to your guidance, and we appreciate all what you have been doing for us at the National Pharmaceutical Services and Ministry of Health at large. We thank the Honorable Minister of Health for being able to make it here again and again, despite his busy schedule. I mentioned it at one of the meetings that he's one honorable minister who does not only concentrate at the strategic level, but he comes down to operational level to sit with us, plan with us, and implement with us. Honorable Minister, thank you so much. I thank my staff who are always willing to be here, come rain, come shine. Sometimes I even feel shy to call them, but I mean, that's the nature of the work. They are always there to serve the motherland Gambia, and I thank you all for all your support and being here at all times. Thank you. I must also thank all the colleagues, the health workers, who have been very supportive to us, because again, it's one thing providing the materials, it's another thing utilizing them. And then the feedback we are receiving from them is always helping us to grow bigger and to manage the stock that we are managing here efficiently. We thank them all for that feedback we are receiving from them. And the media, thanks for coming. I think we are friends now. We've been friends ever, and then we always welcome you, and then we are ready to share whatever information that you may require to know. On that note, I want us all, Double R and the team, that at the Central Medical Store, our motto has always been transparency, efficiency, and due diligence to our job. And we ensure that whatever is given to us, we take care of it and deliver it to where it's most needed. Thank you once again.
Thank you very much, Director, for that wonderful remark, closing remark. Now I will open up the floor for question and answers, and of course I will give it to the gentleman. Yes. Okay. So we finish the and then okay. So I think that is a good idea. So we will do the short
where the monitors? Where the monitors?
They didn't put them in. This one are heavy. Is it okay?
It's heavy.
We can put it maybe here, and then we do it.
I don't know. You can place it somewhere. So thank you very much, WR, once again for this wonderful gesture, and thank you, Honorable, for the great presentation. So now we open up the floor for general question and answer. So again, back to the gentleman again for your question.
We've seen that several countries have introduced temporary bans on the use of the AstraZeneca COVID-19 vaccine. And as a result, people have been, spreading all kinds of messages, especially on social media. So I would like to get your reaction to that.
All right. Thank you very much. Can we take one more question, one or two? before we allow them to respond? That's all? That's all we have for today? Okay, thank you so much. So, Honorable, so the question, I guess, is some countries are banning to have a temporal hold to the AstraZeneca vaccine. What's our reaction to that as a country? Hence, we are also using the same vaccine.
Yeah, thank you very much for the question. Even though I don't know, I didn't hear all kinds of things they've been saying on social media, but I wish I had heard. Maybe I would have been able to address them directly. But what I know is that, yes, we've all heard about some countries having taken those precautionary measures. They are called precautionary measures as suspension. But yet still, as a country, we know we go by international standards. Actually, it has been done by one country or the other and gets to be disseminated on the news platforms. We go by international guidelines. There are expert committees, and typically WHO is the custodian of those guidelines when it goes to the international arena. So countries listen to the WHO, and from the information we are getting, it is not recommended. WHO is not recommending a ban. Yesterday we had a meeting, and when we had that meeting, it is believed that the benefits outweigh the risk. Even if you look at what is elsewhere, when they talk about the thromboembolic phenomena, and you would have heard the analysis being that even that is not beyond what ordinarily happens in the communities without vaccination. So not that there is a spike in thromboembolic phenomena, but nonetheless, over the weekend, so these things happened yesterday, Friday, when we got to hear about this. So over the weekend, no vaccination was taking place in the Gambia, so that we meet and look at the advice, and that's what we did exactly yesterday. And as we speak today, we have an immunization technical advisory group that is meeting today to look at the vaccination issues, and you'll be informed accordingly. But the advice is now not to really stop, because that's the WHO advice, right? But before we had the meeting to even get that advice from the technical, we also over the weekend did not vaccinate to be on the safe side. But the advice is to continue vaccination.
Thank you very much, Honorable. With that, we come to the end of today's session. Just to recap quickly, especially with regards to the question from the gentleman, I think there's a lot of things, yes, we know going on social media, but again, all goes back to what the Honorable Minister and the WR said. With regards to information, always verify. As you are doing, always verify with the right authorities. And if you don't have the platform to ask them directly, always call 1025. I think that is very important, where our respondents will give you the right information. Thank you so much for coming, and we hope that we will together end this fight in the country, and we will do the respond together, and we will all win against COVID-19. Thank you all.
Aka kenu nyameng ñinam programme to mum dina la Gambian Talents TV araba kabotala nani foka jitala luluka nin ko aka kenu nyameng ñi ado ni ciosano le fere nin ko ado ni ciosano akita ko mu yanu ka mabotale nañu jamano molo mu yalon ko fa ya ado ni ciosano la mbake molo mu yalon ko fana ya ado ni ciosano la bari man fin kankuran la maño bito hani fa kaseboyo ntakadi touré mbina la ligue ko kuol narale.
Supersonic's money transfer is giving you an unbeatable bonanza from now until the end of October. Yes! From now till the end of October, you stand a chance of winning a bag of rice when you receive monies in the Gambia from UK, Europe, USA, Canada, and Switzerland with Supersonic's money transfer. Amazing! So from now till the end of October, every time you receive monies in the Gambia from UK, Europe, USA, Canada, and Switzerland, you stand a chance of winning a bag of rice. Only 100 bags available, so hurry now and be part of the 100 lucky winners in this special unbeatable bonanza from now until the end of October with Supersonics Money Transfer. Enjoy our safe, fast, reliable, and convenient money transfer service with the largest payout network in the Gambia with charges starting from $0. Yes! Visit the Google Play Store or the Apple Store today to download the Supersonics Money Transfer app and enjoy excellent money transfer services only with Supersonics. The unbeatable bonanza with Supersonics.